Hi, I'm Kathy Ulrich, CEO of Northern Health. Practicing proper hand hygiene is very important to the prevention of disease. The hand hygiene isn't just about washing your hands, it's also about taking the appropriate steps to do so. I recently spoke with Deanna Hembroff, who is the Regional Manager of Infection Prevention and Control, about an auditing system that she is putting in place across Northern Health to ensure that staff are using the proper hand hygiene practices.
Well, hand hygiene is the cornerstone of preventing infections. So it's the cornerstone of infection prevention. And what we want to be able to see is we do know that we can decrease various types of infections by continually washing our hands, including our surgical site infections. We started an auditing process for Northern Health, and we have a form that is standardized across Northern Health that we're currently using. The audit itself is an observational audit. So what that means is that there's actually a person following people around and seeing whether they're washing their hands and when they're washing their hands. The audit itself, we're looking to see, are people washing their hands prior to entering and seeing a patient, and are they also washing their hands after they finish with the patient?
I also spoke with David Bowering, who is the Medical Health Officer, about the importance of hand hygiene for physicians and other staff.
As a physician, I can say that I've gotten more and more involved in the more high-tech components of my trade. Even though I'm a public health physician, there are still a lot of technological advancements. But the very fundamentals of medicine that we sort of got to at the turn of the century and before, which is asepsis, which is having clean hands when we touch patients, has become increasingly important because the organisms that we deal with are more complex, have been sensitized and selected through the heavy use of antibiotics. So our patients are at risk unless we go back to the very basics of washing our hand every time we touch a patient, every time we go from room to room. These things are vital, and it's easy to forget about them with the fast pace of our work. And so it's a good chance to take a look at it. We've got a formal audit in place, and we can make a difference. We can improve patient outcomes by something as straightforward as simply washing our hands on a regular and consistent and effective basis.
I would like to thank Deanna and David for taking the time to talk to me about hand hygiene. For more information about how to wash your hands and how to use hand sanitizer, please visit northernhealth.ca. Thank you.